I'm Dr. Hussam Hawamdeh. I'm the head of structural interventions at Baptist Health. So atrial fibrillation, which we refer to as AFib, is a process of irregular electricity in the heart. It's a very common, especially among the elderly, abnormal rhythm of the heart. By itself, it's not dangerous. The major danger that comes with atrial fibrillation is blood clots can form in the heart. And when a blood clot forms in the heart, it can go to the brain or to other parts of the body, including the heart, and cause a lot of damage. For those patients, we ideally want them to be on blood thinners to prevent those blood clots from happening. As people enjoy more birthdays and more diseases tend to happen in their life, the risk of bleeding with blood thinners get higher and higher. And unfortunately, we reached a point where it's no longer safe to have patients on blood thinner. WATCHMAN Flex is a device that offers us a second option to protect those patients from having strokes or heart attacks from blood clots that formed in the heart. We do that percutaneously, which means there's no open heart surgery. We do everything through a small poke in the groin area. We poke a hole in the heart and get to the part of the heart muscle where most of blood clots tend to occur in patients who have atrial fibrillation. And we use a device that pretty much looks like a jellyfish. It looks like an umbrella that we deploy in the part that's called left atrial appendage, where 90% of blood clots in patients who have atrial fibrillation tend to occur. It takes around somewhere between 6 weeks to 6 months for this device to be completely covered by our own tissues. And we confirm that the device is completely covered based on the strategy that we use afterwards. And patient does not need anticoagulation or blood thinners afterwards. Some of my patients fall frequently. They end up injuring a joint. Some of my patients have actually been on blood thinners and continues to have strokes while on blood thinners. Other subset of patients is patients whose livelihood depends on using sharp tools, and they have elected to stop using blood thinners because they were not able to generate their daily income because of that. So those are all fall under the umbrella of appropriate patients for WATCHMAN procedures. I think it's a very exciting step to have this procedure done here locally at Fort Smith. We'll be able to provide a lot of help for a lot of patients that have run out of options otherwise.